Hello, I'm Dr. Brian McDonough, and welcome to the new normal for May 17th, 2020. Today, I want to talk a little bit about blood clots. Now, I won't get too technical, but here's the issue. A certain percentage of people, maybe 20 to 30% of people with COVID, have issues with blood clots. And the theory is COVID seems to attack the lining of blood vessels called the endothelial lining, and in certain blood vessels increases the risk of little clots and even bigger clots. Now, we've seen some disastrous changes. For instance, people in their 30s or 40s having stroke because they get stroke symptoms as a result of blood clots in the brain, stopping the flow of oxygen in the brain. But we're also seeing it in our sicker patients, people who actually have respiratory issues, they're short of breath, and when they get a measurement called a pulse ox, where they look at the oxygen level, it's down like 91 or 92%, which it's really down at a level where you wouldn't expect it to be. And normally we may want to put somebody on a ventilator with these symptoms as it gets worse and worse. But what the scientists are realizing is the lungs certainly are infected, but the bigger issue may be these clots. The clots are blocking the flow of oxygen in the body. Now remember, oxygen is carried by red blood cells all around the body. So if there's clots, these clots can actually slow down the oxygen release. And what scientists are now realizing is they don't necessarily have to put people on ventilators as quick as they might have in the past. The second issue is these clots don't necessarily respond to the classic blood thinners because something different is going on. So right now, a lot of time and energy and research is going into finding out why these clots form and what we can do about them. Now, what it means for you, for your family, it's just another example of why COVID has to be taken seriously. And we have to worry about it through all age groups because not everybody in younger age groups is getting off scot-free. That's an important lesson too.